The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, board-certified periodontist, Dr. Joe Nemeth. Dr. Nemeth, welcome to the program.
Thank you, Randy. Pleasure to be here.
Now, before we get started, tell me a little bit about your practice. Who's your typical patient?
My typical patient is not a typical patient. We really don't have a typical patient. We have a huge variety of patients. We have, being in Detroit, we have a lot of people who are in the automobile business. We have children who come in to have their gums reshaped. We have adults who come in to have their teeth replaced. We have moderate income people, we have wealthy income people, we have a wide range, we have a lot of executives who are rather affluent, so we have just a huge range of individuals.
Now, as a periodontist, I'm saying that right?
Yes.
What is a periodontist? I mean, what is your specialty?
Well, perio means around and dont means teeth. So we don't treat the teeth, we treat what's around the teeth, which means we treat the gum and we treat the bone and the supporting tissues that keep the teeth in place. Okay. So we treat the tissue around the teeth as a periodontist, not the teeth themselves necessarily.
Now, what does cosmetic perio means?
Well, you know, in our society, in the United States, everybody wants to look good. Everybody wants to look young and beautiful and good and be acceptable, and so cosmetics that's what it is. It's cosmetics. It's appearance. It's
like taking care of the gums and things like that.
Well, taking care of the gums is part of it. Absolutely. Well, there's health and there's cosmetics, and their periodontal treatment is primarily aimed at health. Getting the gums healthy, saving the teeth, stopping bone destruction.
But cosmetic perio is?
Cosmetic perio is reshaping the gum tissues so that not only are they healthy, but they're beautiful, they're attractive. So when you smile, you're proud to smile. Your gums are even, they're not swollen, they're not distorted. Your teeth aren't too long, your teeth aren't too short, and all that can be modified and changed and improved by the shape of the gum tissue.
Now, in a tough economy, people are still want to look good with their teeth, you say. Is that right?
In a tough economy, you need to look better than ever, because in a tough economy, if you want to if you're looking for a job or you want to keep your job, you want to look good.
Good point. Okay.
So a tough economy, people need that even more. Sometimes there's more difficulty affording it, but people know that they need it.
Now, you offer sedation.
It makes it wonderful for the patient. The patients relax, they're comfortable, it's easy for them. So we put them in a twilight sleep, or we put them to sleep. They wake up, the work is done, it's finished.
Isn't that how everybody wants it, though?
Everybody wants it.
Well, does it make it easier on you, by the way, to work on a patient that's not...
It's so much easier on me. If that patient's not tense and not anxious, then it's just much more comfortable for me. I can work more comfortably, and the patient is just relaxed. It's great. It's really, in my opinion, it's the only way to go. And I think it's actually safer for patients.
So the dental phobics, they love this, obviously.
They love it. We love it.
Do you still hear, doctor, I don't like going to the dentist. Do you hear that?
We have some patients who are not happy about going to the dentist, but we tend to change that experience for them. And by the time they're finished in our office, they say,
like it. They like going to the dentist.
We get thank you notes all the time. We really do. It's wonderful.
Now, part of your practice, which I invite you on the program to talk about, dental implants.
Yeah.
Very popular now.
Very popular, but not as popular as it's going to be.
Okay.
It's going to be hugely popular. Not long ago, I think it was Jane Brody, in the health reviewer in the New York Times, came out with an article saying that basically dental implants are now going to be the standard of care for replacing missing teeth.
Because instead of what? Instead of what? Bridges?
Instead of bridges. Well, let me show you an example here. You have a missing tooth here. You have a tooth on either side. What you do is you put an implant in the bone here. You don't have to touch this tooth. You don't have to touch this tooth. You take an implant, you put a tooth on the implant, you're done. The implant.
This sounds pretty simple.
The implant, it's so simple. The implant never gets decayed. It's not made of tooth structure, so it doesn't get decayed. It doesn't get gum disease. Typically, implants will last a lifetime.
Knowing you were coming today, okay, so on the internet, 20 million Americans, upper or lower denture, and that's a big number, but I don't think anybody realizes that.
Gotta
Do
have
you think it
implants.
starts somewhere? Do you think that if you were able to get implants earlier in people,
Yes.
that it would prevent future tooth loss? And if so, I don't understand
I'll tell you
why.
why. I'll tell you
Okay.
why. First of all, if people lose teeth, let's say you lose 2 or 3 teeth, okay? And you don't have those teeth replaced, and they're back teeth, let's say they're back teeth, so you can't have them replaced because there's no anchors. You couldn't even have this kind of a bridge. So what happens is you've got fewer teeth. Well, when you've got fewer teeth, those fewer teeth have to take more pressure because there's not enough teeth.
So it's a snowball effect?
Yeah, so to take all of the pressure of chewing. So as you lose teeth, the remaining teeth have a greater and greater burden of pressure and are more and more likely then to possibly fail because of the increased stress on those teeth. Well, if you lose a tooth and you put an implant in right away,
Stop the process.
then you can stop that process because that tooth, that implanted tooth, will then absorb some of that pressure and take some of the stress off of the other teeth.
Is it hard to get that one tooth implant in? I mean, because we invited you to talk about this no more dentures,
Gotta have
teeth in a day.
Implants are the way to go. It's not hard, it's simple.
So that's one category, people missing a few teeth.
And it's not painful. Implants are not painful. People think they're
seems
painful.
very painful, by the
Okay,
way.
bone has no nerve endings in it. So bone, it's not painful. The gum tissue has
But there's got to be some pain.
I don't like to use the word
discomfort?
pain. Discomfort, sometimes there's discomfort, but not a lot. Patients don't complain about it. It doesn't
that's
really
good.
seem to be a
They
significant
take an
problem at
Advil,
all.
what do they take?
They take an Advil, they take an aspirin, they take nothing, sometimes a Motrin. It varies from person to person, but usually there's not significant pain.
What are the age ranges, by the way, of dental implant patients?
You
that
know,
see?
it wasn't really that long ago that we did some implants on a 90-year-old physician.
90-year-old.
90-year-old doctor wanted
Why
to have
would he
dental
want to do
implants.
that, though?
Because he wants to enjoy his life. He's still alive. He's vital. He wants to get every moment of pleasure from his life that he can, including enjoying food and tasting food and chewing food. Well, he wants to enjoy his life. And just because he's 90 years old, he's not dead. He's still alive.
So they're not too old at that age. So they'll stick in there.
They stick in there and they're doing well. There is
Interesting.
like no age that you're too old for.
How soon can they eat?
They can start eating the next day, typically.
Really?
Oh, sure. Yeah, we can now put implants in, not in all cases, but in many. We can put implants in and put teeth on them the same day, and you can go home and start eating and chewing that day.
Moving right along here.
Okay.
The denture wears.
Okay.
What are their
Let me move
options?
this out of the way and let
Okay.
me bring this over here. This is a typical lower denture. And lower dentures are pretty horrible. People have a great deal of difficulty with lower dentures. They slide around, they irritate the tissue. They have to put this goop inside of them to hold them in. And then sometimes if they have certain kinds of hot foods, that goop melts. And you know, it's just not really cool. And they're very unhappy.
In
with
Detroit
it.
alone, how many denture wearers you think? I mean, more than thousands?
I would say, my guess would be a few 100,000.
Okay.
I don't know the official statistics, but
At
that
least.
that would be a rough guess. Yeah.
Okay.
And lower dentures are really can be very, very horrible and very difficult.
What do they say to you, by the way, the lower dentures?
You know, they say that I can't wear my denture. I take it out all the time. The only time I wear it is if I'm going out socially, just so I have something so that people can see that I've got something. Sometimes they even take it out to eat because it's more comfortable for them to eat without that lower denture in than with it in, because it slides around, it irritates the tissue. There's nothing to hold it. Well, you'd think that the lower denture would be great because gravity is holding it down. No, it doesn't. It slides around. The upper denture, which actually doesn't have gravity in its favor, has suction, which actually holds the upper denture in better. So people has, not that they're great, but there's less problems typically with an upper denture than there are with a lower denture.
Okay, so for the denture wear, what are we looking at there?
Okay,
What is that?
This is the denture. We take this off, and there are 2 implants right here, which you can see. And that's all it takes. It's 2 implants, and then this denture and the same denture can be used.
So there's little fastens then.
Yeah, there's little receptacles in this denture that snap onto these implants, and it goes on like that.
Is this an accurate
Yeah,
feel, by the way?
this
Let me
is
see
accurate, and it's like a rock.
So
I'm
2 implants.
You have to take like
Let me see this,
weightlifting lessons to get this thing off of here. It's really on very solid.
Okay. So this is, that's very tough. So 2 implants.
2 implants.
Okay.
That's all you need to hold
Do you
that
think
on.
people count their teeth and think, oh my goodness, I can't afford dental implants?
I think people think dental implants are much more expensive than they really are. They're not as costly as people think.
Now you're a specialist,
Yes.
periodontist, okay? Is it more, do they need a referral from their general dentist to see a specialist, and are you more?
Our fees are no higher than a general dentist for implants, as far as I know. I mean, I've not compared fees, but I know that some patients coming in have been quoted higher fees and some patients lower fees. So it really is variable. I don't think that because you go to a specialist for implants.
So it doesn't cost more to go to a specialist?
It doesn't cost any more. And you do not need a referral to come to our office. Many of our patients are referred. In fact, most of them are referred because they think they need referrals, but you really don't. You can anybody can call the office.
So they can call you directly, get
Absolutely.
Get a consult.
Absolutely.
Now one of the things we're talking in the green room over there, and you said, Randy, if there was a try-in period,
yes,
for a denture wear with they couldn't go back. You believe that?
Yeah.
Tell me about that.
They'd never go back because once you've got the dental implants in, it feels like it's just solid. It's rock. It's in there. You don't have to worry. You can chew comfortably. You never want to go back. In fact, what's very interesting is very often people will come in and they just want a couple of lower implants for their lower denture because they're really okay with the upper denture. And so we give them the implants and they're wearing their lower denture with the implants and they're great. It's solid. They can chew. They're comfortable. Socially, they feel good. But then they realize that upper denture, which they thought was okay, it really isn't okay compared to the lower denture. So then they come back and we do some upper implants so that they can lock the upper denture in just as well as the lower. There's such a need for implants. There's so many people that could benefit by dental implants that don't even know about it. I just think we could render such a service to so many people in Michigan, the Detroit metropolitan area, that there's a need for a resource center, for a dental implant resource center. There's that kind of need, and so many people would benefit by it, be grateful for it.
So it's just eating,
be a wonderful service.
Eating and chewing.
Eating, chewing, and looking too.
You say it's a boost in the self-esteem. How so? How so? Give me an example.
Well, sometimes people are afraid. If they've got an upper denture, for instance, they're afraid that their upper denture isn't going to stay in. It's going to be, people are going to notice it, or it's going to get loose, or whatever it is, and they're afraid to smile. They put their hand up here because they've got the denture. They're just uncomfortable about it. Well, you've got something that looks good. It's in there permanently. It's solidly. All of a sudden, your self-confidence is like totally changed.
Well, people that are dating, I'm sure, don't like to admit. Because 70 is very young today, 60. Yeah. They're on Match.com, things like that.
Yeah, dating is very important. And the other thing that we can do now is, of course, we can do fixed dentures that don't come out. You mentioned it before, where you put four.
That's the all-on-4.
Yeah, you put 4 implants on the top, 4 implants on the bottom, and you've got permanent teeth that are in there permanently. No snap in, snap out. They don't snap in.
Is that for the younger patient? You have to be younger?
You don't have to be anything. No, it's for the older patient. It's for
any
patient. Yeah, it's great.
Okay, but if
you know something. You know what's great about the ones that are permanent? You don't soak them in water overnight. You don't like take them out and put them in the thing. Like soak them in the water. You know, what I was telling you, we had talked about this a little bit earlier. I was telling you, dentures, let's face it, dentures are made out of plastic. Plastic is not like steel. Plastic is porous. It absorbs odors. It absorbs bacteria. It absorbs materials from the mouth. Do you ever really get rid of that if you wear? Yes, you soak it overnight in some kind of a soaking thing to help get rid of it, but I'm not sure that
So they
really
carry
does.
an odor with them?
I think that dentures have a little thing going. Maybe yes.
Okay. If it's as good as you say it is. Okay. If it's as good as you say it is. Okay. 4 implants for the right candidate. A couple 100,000 or more people in Detroit with dentures. Why aren't they all doing it?
I don't think they know about it.
Really?
I think they don't. Either they don't know about it, or they think it's too expensive, or their dentist. Some dentists really are not.
They don't do it.
So if you don't do it, you're not familiar with it, and so that's another reason why it's not recommended.
Have you ever had patients?
Quite frankly, I hate to say that, but it's true.
Do you ever have patients that say, I wish I would have known about this years ago, wish I would have done this a long time ago?
I have few patients that don't say that. Most of them do. Most of them are extremely happy with it.
And they're surprised that it's not, as you say, it's not, pain is not something to keep you from doing it.
Pain is really not a problem. Sometimes some minor discomfort, but it's really not a problem. Dental implants are wonderful things, and everybody should have them if they have missing teeth, and it's just as simple as that. They're
Eating,
great.
chewing.
They last a lifetime. Mostly they last a lifetime. 95% of them last a lifetime. They're like your own teeth. You can chew like your own teeth. You have a social comfort that you don't have otherwise. It's like, why would you have anything other than a dental implant if you can have a dental implant? And then there's some people that, we talk about bone. Do they have enough bone? Well, if they don't have enough bone, we can create enough bone. We can add bone. We can build up the bone. All these things are possible. We're doing all kinds of things now that we couldn't do before.
Interesting. Okay, and we're going to take a quick break. We come back. More about the process, what people can expect on day one, imaging, sedation, all of those things. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about the dental implant process with Dr. Nemeth. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have a board-certified periodontist, an expert on the topic of dental implants, Dr. Nemeth. Okay, so as a recap, so for the denture wearers, 2 implants,
Yes.
snap in, snap out.
Absolutely.
And I got to tell you, because you have a lot of enthusiasm about this.
Huge.
We talked at the break. It makes me smile. People are tuning in. I don't want people to think I'm laughing at you, but I can appreciate this enthusiasm. And these are real interviews. I mean, this isn't scripted.
Right.
Why do you like it so much, though?
Why
does it give you so much pleasure, dental implants?
I love it because it's the right thing to do. You're doing something great for the patients. The patients appreciate the heck out of it. Your patients appreciate the heck out of it. And it's like, great, minimal trauma. You're giving them back their own teeth, and you're improving their health. You're doing everything good. I mean,
now, why is it though that it's less downtime now than it was 10 years ago? I mean, help me understand what's changed.
10 years ago, they thought that you had to leave the implant in for 3 to 6 months to allow it to heal before you could put any teeth on it. Well, we're finding with newer materials and with the newer implants and with the newer techniques, you really don't need to do that anymore. You don't need to bury that implant under the gum for 3 months or 6 months. In many cases, you can put teeth on it right away simply because experience and newer materials and techniques have taught us that now we can do what we couldn't do 10 years ago. So that's really made an enormous difference.
Now, my mother, 74, convinced she's too old for dental implants. Her medical doctor said, you're too old for dental implants. She's been in dentures, by the way, since she was 28. Is that a common thought,
She is too old for dental implants up here.
Interesting.
But she's not too old for dental implants here. I mean, how can you be too old for dental implants?
So you don't think there's a happy denture wearer out there?
Well, do you think they think they're happy, but they're not as happy as they could be. It's like people who live in what Russia used to be. Okay, they used to live in Russia, and they thought, hey, everything's okay, till they saw the light or came to the United States, and they realized, hey, there's a whole new life. There's all kinds of possibilities out there. So they're not terribly.
They don't know what they're missing.
They don't know what they're missing. They really don't.
But is it true though? The first week of a denture wearer's life is pretty miserable, right? And then they just adapt to these dentures? What's your take on that?
Humans are infinitely adaptable. They just sort of adapt or resign themselves, let's put it that way, to it. But they really aren't happy. They're really never comfortable. I won't say they're never comfortable. Some of them are comfortable, but they just could be functioning so much better and able to do so much for the most part.
Denture wearers don't hear this that often. I mean, they don't go to the dentist. Who's telling them to do it?
Who's telling them to do what?
A denture wearer, to get dental implants. I mean, if you're a denture wearer, I mean, how often do you go to the dentist?
Yeah, you don't go to the dentist very often because you're a denture wearer. So if you're not going to the dentist, nobody's going to tell you to have the implants because you're not seeing the dentist to tell you to have implants. And then again, a lot of dentists really don't do dental implants, so they will kind of let things go also.
Interesting.
Yeah.
Okay, now imaging, you're doing...
Yeah, and things that we couldn't do 10 years ago or didn't do, we can do now, because with the dental imaging devices that we have in our office something called an iCat. It's a CT scanner, and that allows us to see exactly how much bone there is, how thick the bone is, where the bone is, so we know exactly where to place the implants, how many implants we can place, how long the implants can be. We have a diagnostic tool available to us now that we never had before that enables us to do all kinds of things with implants.
Is it less
that we
cutting
couldn't do before
than the old days?
There's much less cutting, and sometimes there's no cutting. Sometimes we can actually just do what's called a flapless procedure, where we actually take a dental burr and just go right through the tissue without even making an incision in the tissue and put the implant right through it. So sometimes we can do it with no cutting at all.
Interesting. Now, what about if a woman or man, they have a touch of osteoporosis? Can they still do this?
Absolutely, they can still do it. We may use different implants, different size implants, but there are very few contraindications. I'm not saying there are none, but there are few contraindications or reasons why you can't have dental implants.
This is the future of dentistry?
It's the future
No more
of dentistry.
bridges or partials or any of that stuff?
I think they'll be rarer and rarer and rarer. Yes.
Okay. Okay.
I'm not saying they'll go away completely, because there's always some exceptions.
Now, the people, by the way, and I know
Randy, let me ask you a question. You
Yeah.
break off a front tooth or something happens to a front tooth, you've got a choice. We can grind down the teeth on either side so that you might need root canals and get cavities on it, but even if you don't, we can grind down those 2 teeth, put caps on those 2 teeth, or 3 teeth, maybe you're missing 3 or 4 teeth. We can grind down those end teeth, put caps on them, and then put a fake bridge there. Or we can put implants in and replace those teeth individually without doing anything to the other teeth. You have a choice. What's your choice?
Interesting.
Absolutely.
Is that an oversimplified way to put it, though?
I don't think it's particularly oversimplified.
I mean, because obviously when you put it that way, it's like, why would anybody choose the other?
Right.
Unless they weren't offered the dental implant.
Why would anybody
Is it
choose
cheaper in the
other?
long run to get a dental implant? I mean, with root canals and, et cetera.
I think it's cheaper in the long run. If you're replacing, let's say you're replacing 1 tooth with a bridge versus a dental implant, the cost really is about the same, because you have to do work on the other 2 teeth. The
So why
cost
not
is
just
about the
get
same, and then you risk the idea of the bridge failing in the future, possibly getting decay underneath, possible root canals being done. So my own feeling is, cost-wise, in the long run, dental implants are the way to go.
And get sedated. Get sedated. They don't even know the procedure took place.
Get sedated or don't, but I think sedation is the way to go. It's so much easier for the patients.
An IV sedation.
IV sedation is wonderful. It just makes life so great.
On the phone you said, I don't even really ask them anymore. I just say, this is how we do it. Is that true?
It's just how we do it, and patients love it. They just love it.
Why doesn't everybody do it that way? Because nobody likes that feeling, somebody working on
I
your
can't answer
mouth.
why everyone doesn't do it that way, but we do it that way, and it's great. It's just great. Some people feel that, you've got to go through a lot of training. You've got to go through a lot of additional training to use
Oh, so
IV
there's special
sedation.
licensing?
Well, there is special licensing. Yes, there is. At least in the state of Michigan, there is.
Okay.
And you have to go through a lot of training, and and you have to get comfortable. And I've been doing it for a long time, and I love it. And I actually think IV sedation is safer, especially for people who are at risk health-wise, because it relaxes them. Their blood pressure goes down. They don't have a tendency to faint. I mean, I just think it's a safer way to do things.
All right. Well, great stuff. Good stuff. I want to thank you for coming on the show.
Thank you so much, Randy.
This is all on your website. Is that right?
Most of it is.
Okay, good. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, or you have a friend that is wearing dentures and you want to point them in the direction to see this interview with Dr. Nemeth, you can go to our website at wellnesshour.com. Just put in Detroit Dental Implants or Dr. Nemeth, and we'll set up a link on your website for this interview as well.
Okay.
Okay. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
If you'd like to schedule a consultation or learn more about dental implants and periodontal disease, call Dr. Nemeth's office at 248-357-3100 or talk to your family dentist.